And first, let's start with the ministry's knowledge of this agreed conditions of service that dates back to 2024. Exactly what do you know about the issues that are leading to the strike? And what kind of conversations have you had with them earlier?
Thank you very much. Since the assumption of duty by the Minister for Health, he's met the nurses about 5 times. So during one of the meetings, it came to light that they signed some agreements with the healthcare administration, and that agreement was actually not implemented. So they want the current Minister for Health and the current government to sign that document for implementation. So the minister requested that they come back, get a person, a representation from their end. We also get one person from the Ministry of Health and another from the Ministry of Finance, so that we'll form a smaller committee to look at their issues, because it has budget implications. What we are talking about, it means that a chips compound or a health center in my village in Alaspila or Aslaw, Navrungu, would have to cough out some money for its workers. So it's important for us to also disseminate this document. Make sure that all stakeholders are aware of what is in this document. So at the end of the day, you are supposed to pay 13 months salary to workers in the various hospitals. The managers of these hospitals must be aware. So this committee should come together, develop something for all of us to look at and agree on how we should implement or otherwise of this document. This was agreed. The minister, together with the president of the nurses executive, went to Geneva with other health workers to represent Ghana at this year's World Health Assembly. They all arrived on Monday, this particular Monday. On Tuesday, the president was in the ministry. We all went through this inauguration of the various boards and councils. We didn't hear. We were not told that there was going to be any press conference, any strike or declaration by any group, only for us to be told by the media or here in the media yesterday that they've declared strike. They've declared series of action leading to total withdrawal of service. And we're taken aback. I must say that the minister was shocked. All of us in the ministry were surprised by this action. And then we want to just say that let's show good faith at all points when we are having some negotiation. Because it's not as though the door of the ministry was shut. They come, they don't meet the minister. They have been meeting this minister for more than 5 times. So, my brother, this matter, I don't know whether it has any other reason, but if it's just the normal reason, we all know that we are bargaining for our collective agreement, then I can tell you that they have not been fair to the minister.
Was that committee ever formed? The committee that was proposed by the minister?
So, after this meeting where we agreed, the minister proposed actually that this committee will be put together so that he can understand what he's dealing with. Then they had to leave for this World Health Assembly. So they arrived just this Monday. They have not submitted a list. They have not submitted anybody to represent them on the committee. So I can phantom what actually necessitated this action. So I'm not surprised that about 5 other groups of nurses are saying that they are not ready to embark on any industrial action because they believe that they have to engage further.
When this proposal was made by the health minister, was the Ghana Registered Nurses and Midwives Association represented in that meeting?
Yes, but they were there.
Did they express any disagreements with this proposal from the ministry?
No, they never disagreed with the minister. when the minister proposed, because they mentioned the issues in the document. The minister said, okay, no problem. Let's put together a small team to look at the issue and then we'll see how best we can carry it through. No disagreement. We all left that meeting happily.
Was that the first time the minister was hearing about this particular document?
No. That was about the third time. You know, initially they came to have some courtesy call to introduce the executives and all that. Then they mentioned series of issues that must be attended to by the minister. So the minister started dealing with them. And then they said the top on their agenda, because they are going for their council meeting, is this condition of service. The minister should look at it and sign. So how do I sign a document I didn't even bargain with you on? How do I sign this document? You let me understand it. Let me see what is in it, so that all of us can actually see how best it can be implemented. You know, we are not saying that the ministry has not, or the minister has not gone through it. It's read the document, but it has a lot of financial implications. And you have to weigh that against the numerous pressure and burden the health sector is facing. We are looking at providing 500 bed facility for the children of this country. We are looking at retooling the various hospitals. Because as I speak to you, the hospitals, most of them have no equipment to work with. We are looking at that. Mama care is on the agenda. So if you want to prioritize or you want to do something for the people of this country in respect of the health sector, what would you want to do first? Do you want to just use all your budget for this? You have to prioritize. So let the team sit, agree, and then the minister will just carry it forward. That is what we are saying.
Now, it's always said government is a continuum. It seems they agreed with the immediate past government on this, because they had some consultations and they went through the processes, and there was an agreement that this was good to go. So perhaps if government is a continuum, was the least they should expect of you not to just implement?
Sana, government is continuum, yes, but there is also a change of government. So if you change government, it is because you need a different driver to redirect the vehicle. So if you have a new driver who is in the vehicle, checking engine to take off, you have to exercise patience with that driver. The people of this country did not change because they want the other things to continue. They want somebody to redirect. So you must be able to convince the person that the agreement that I signed with the other government and he was not able to implement, the one who didn't sign the agreement was not able to implement. And you are saying that the one who did not have anything, prior knowledge of this document, should implement. It doesn't work like that. You must understand and see how it fits into your budget, it fits into your priority, and then you carry it forward.
Now, today is 29th May, and you said you heard of the strike. Was it yesterday?
Yes, yesterday afternoon.
Okay. They said the strike will be effective from June 2nd. I'm wondering what steps you're taking to ensure that this does not happen, because the Ghana Registered Nurses and Midwives is quite a sizable association.
That's true. We will continue to engage them. We believe that they should rescind their decision and come back for us to continue the discussion. They should nominate their rep, and then we'll get the Ministry of Finance to also nominate a person. The Ministry of Health gets a rep, so that we look at the whole document in totality and see how that message can be implemented. Let's not forget that the first ever condition of service to be implemented in the health sector in this country was actually introduced by the first Mahama-led administration. So we have the health sector and its workers at hand. It is something that we have done. implemented, introduced and implemented. So we are not people who do not understand what goes into the welfare of the people. We know. So we will definitely make sure that the best is done for our people.
And that's on another note. I wanted to also ask, on a different matter, when did the ministry inaugurate the board of the National Health Insurance Authority?
Please, they were inaugurated on the 27th of this month.
Was there a certain Anne Sansadali part of the board that was inaugurated?
No, please.
She was not on the board.
She was not on the board.
But her name was on the list that has been circulated as the members of the board on a green letter.
So let me give you the scenario. What actually happened? The first letter that came to the Ministry of Health on the 19th of May has Ms. Ali Sanza Dali's name on it. By 23rd of May, a different letter came revoking her appointment and replacing her with another member, which is 23rd. So by 27th, when we were inaugurating the board, her name was not part of it. But because the initial document has her name and other person's name, her name was not part of it, but you have other persons. So that document was actually maintained. The new one that appointed Professor York revoked her appointment. So I was surprised to see in the media that she was part of the persons who were inaugurated and all that. By 23rd of this month, before this go out in the media, a decision was taken and a letter was sent to the Ministry of Health.
So, was Professor York part of the board that was inaugurated?
No. You know, in transmitting the letter, it takes time. By the time it gets to the ministry, of the going through all these protocol or about bureaucratic issues, you would have missed the deadline. And you have to also communicate to the person with a letter. And the person must be available at the time you are communicating. So I'm sure those mishaps are, otherwise it would have been part of the inauguration. But let's make the case that the lady was not part of the inauguration.
Was she a nominee of the health ministry?
No, please.
Okay, so you had no.
You know, with us, we are in charge of some of the institutional representations here. So she was not part of persons from the Ministry of Health.
Tony, always a pleasure talking to you. Thank you very much for making time.
Thank you, my brother.
Tony Goodman, spokesperson for the Ministry of Health, joining us. And for that quick, very, very quick conversation